It was fun to see some familiar names join the presentation, but thank you to everyone who has joined. It looks like right off the bat we have our keyword number one that you'll all want to make note of, and that is health. So take a moment to make note of that keyword. All right, my name is Sam Olson. I've been with Eide Bailly for nearly 4 years. I've had the opportunity to work with many organizations. Some of you who are on this presentation when it comes to data analytics and business intelligence solutions. It's an area that more and more organizations are diving into, critical access hospitals included. So I'm very excited for what the next few years has in store. In this presentation, we're going to be discussing how your organization can operationalize its data through business intelligence. I believe it's a message that is very important in the world of healthcare we're currently living in, and I'm very excited for the audience we have today to hear this message and hopefully find some key takeaways they can take back and visit about with colleagues. First off, I want to express my gratitude for this opportunity. As noted, this is a topic I'm very passionate about, and I enjoy every opportunity I get to visit with and work with hospital leaders like yourselves. Thank you for all the important work you do in healthcare. The industry needs strong leaders who are willing to take on the risk of decision making and be the driving forces behind innovation. In the next hour or so, attendees will be introduced to the application of business intelligence, starting with what BI means, what is it, and how healthcare leaders can leverage this technology to improve operations and key financial indicators. Specifically, we're going to cover the following 4 areas, which you can see. We'll identify how business intelligence can have an impact in your organization. We'll discuss how BI can improve visibility into your organization's data and operations. We'll determine how a custom BI solution can automate much of the reporting processes in your organization. Lastly, we'll discuss how BI has improved one organization's understanding of operations. The healthcare system, which all of you are part of and leaders in, is not only one of the largest industries, but it's one of the most complex, which I'm sure many of you would agree with. The industry is under more pressure than ever before, and really nobody knows this better than those of us in the critical access hospital sector, those of us in rural health. Because of this, it's imperative that organizations have a better understanding of their data in all areas of the business. A better data strategy can have a huge impact on an organization. And other industries have already recognized this and have begun to align their data utilization with their strategy. I'm sure you've seen in the news and just through experiences with these companies' products and solutions, organizations like Amazon, Google, GE have really mastered the utilization of data in driving their business decisions. So while companies from these other industries are leaning heavily on data, healthcare has sort of been a glaring exception for a long time. Many hospitals fail to aggregate their data effectively, leading to much of its data being isolated and what I kind of like to picture as silos. And really that makes it difficult to draw useful correlation. Many organizations have employed individuals or still employ individuals who solely are tasked with data reporting. And many of you probably have organizations in-house right now that do that. These individuals generate reports. They are responsible for creating and feeding reports up to leadership. It's really an ineffective use of a resource, and ultimately it doesn't allow for leaders like yourselves to get the information they need to make crucial decisions in a timely manner. The data that's being fed to them, being fed to yourselves, often comes too late, and it doesn't come to you in a manner that allows for quick analysis. I recently read a report that was pretty alarming. It stated that less than 0.5% of all data is ever analyzed and used. And while this is an alarming statistic, you could also kind of look at it from the other side, and it could be encouraging. What it tells me is that there's a huge opportunity for all of you and for myself working with hospitals to move forward with business intelligence solutions that can be a differentiating factor for your organization. And these solutions impact care, they impact operations, and ultimately bottom line. And another sort of encouraging takeaway from that statistic of 0.5% of data being used is that that's changing, and it's changing now. Organizations that we're working with are recognizing the need for more advanced data strategies. So that's not a statistic that's going to remain at that figure for long. I truly believe that hospitals of all sizes, health systems, critical access hospitals, will begin leveraging data in a pretty significant way in the short term. So at this point, you may be asking yourself, where do I start? So I've introduced business intelligence at a high level. I've introduced some statistics, but you're asking, how do we leverage this data you're talking about, and what data should we even leverage? So the first thing I'd say is you need to consider what data is important to your organization. Many of the organizations I've had the opportunity to work with typically start with these three areas that you see: operational data, financial data, and patient satisfaction data. And the organization I will touch on shortly decided these three areas were where they needed to focus their efforts initially to see a significant impact. And I'm going to jump back to this screen here in a moment, but I wanted to present a Q&A, an exchange that I had with someone that we're working with right now in a business intelligence process, and that's Granite Falls Hospital. So my question that I had posed to them was, what was the primary problem or pain point you and your organization were intending on addressing through the use of BI? And what they responded with was pretty revealing, I think. They said, the implementation of BI in our organization is a result of an operational efficiency study done by Eide Bailly. So we intended to address the departments that were operating inefficiently per the study. We knew this would be a sensitive subject since it would involve decreasing FTEs. We have accomplished some of our objectives already. So one of the primary reasons for Granite Falls pursuing a BI solution was to better understand operational indicators and confirm some of the beliefs they already had on staffing levels. These were beliefs and thoughts that leadership and managers felt to be true, but they just didn't have the data really necessary to confirm those thoughts and support the decisions they were wanting to make. And so far, this has proven to be a useful tool for them in that area. Other areas that BI can provide useful insights in are financial operations and patient satisfaction. Some of the CFOs we've worked with have expressed their desire to have more detailed real-time views into financial KPIs, and ultimately just a well-designed BI solution can provide that. You already have the measures and the KPIs that you're tracking from a financial standpoint, but sometimes those figures are provided to you in a lagging manner. So you might be looking at it on a monthly basis or quarterly basis. Having visibility into these things in a more real-time manner can be really powerful. Lastly, having visibility into patient satisfaction data can help an organization understand what your patients are saying and feeling about their experiences. Are patients largely saying that the care provided to them is great? Are there any pain points that patients are identifying? Is their wait time beyond what is allowable? Do they feel like they're being heard from providers and from schedulers? So having insight into really what your customers are saying can be a very valuable thing. So if you're not yet convinced of the importance of data and the availability of it, here are just a few fun quotes. And really, these are just quotes to sort of get you thinking and ponder. So the first one: more data has been created in the past 2 years than in the entire previous history of the human race. Next, estimates suggest that by better integrating big data, healthcare could save as much as $300 billion a year. So regardless of the even kind of the relevancy of that dollar figure, whatever it is, I'm sure many of you wouldn't mind a piece of that pie. And again, the statistic I already introduced, the moment less than 0.5% of all data is ever analyzed and used. So think about that last one as we move forward, and think about your own organization and the data that already resides in your systems, in your reports, and think about how much you really use it, and think about is it really being leveraged to drive decision making, or is it really just data that exists but not for a real purpose? And so while these quotes are sort of fun to think about and take back and talk about, there really is an important question at stake, and that's who's going to tap into this. There's much to be gained by being a thought leader in this area, and your organization can set themselves apart and gain a significant advantage by embracing data and leaning on it to drive decision making. So in the next few slides, I'm going to introduce 5 concepts or principles maybe that will help you and your organization understand the importance of data, how to align it with your strategy, and how it can transform your decision-making processes. Strive to be data literate. That means investing in the tools you need. Data literacy is really the ability to derive meaningful information from data. So just as literacy in general is the ability to derive information from the written word. So to be data literate, you need the proper tools and resources in place. Without those, it makes it really difficult to accomplish that. Currently, I'd feel pretty strongly saying most organizations don't have those tools in place. And it's not really for a fault of their own. For a long time, a lot of these tools have, because of the price point, have been for larger hospitals or have been for organizations in different industries. But now, because of advances in technology, the price point of these tools and these platforms have dropped significantly, making them much more practical for organizations like yourself to embrace and get on board. So Jill Wilson, our good friend from Ultra Health System, we work closely with her. She recognized the need for this investment. This is a pretty telling quote from her. She said, "Without investing into different tools and supplying more accurate operational information, we won't reach a transformational stage for new phases of care, and we won't be able to pull the innovation needed to reach new goals." So she recognized the tools they needed and recognized those tools were going to be an investment, but understood what the payoff on that investment would be. All right, and we are at keyword number 2. So this word is Friday. So take a moment to make note of this word. All right. So principle number 2, be curious about the data in your organization. Today, healthcare organizations have access to immense amounts of data, whether that's clinical data, operational data, financial data. This is in large part due to EHR adoption, but also just transitions to other electronic systems. Much of this has happened over the last decade or so. So while business intelligence in general isn't a new concept, for healthcare, it's still what I would call maybe an emerging technology, meaning that sort of the adoption rate of it is still in kind of the early stages. So next, organizations need to use this data that is now being sort of unearthed to drive emerging strategies and processes. This data can really alter the processes that you currently have in place and optimize them and make them more efficient. And just as Granite Falls has begun doing, organizations need to create these efficiencies through data. What I always kind of say, the process that I lay out is find the data, build strategy around that data, and then simplify decision making. Principle 3, utilize data to be action-oriented by aligning it to your strategy. And this one's really important, the last 5 words there, align it to your strategy. This expression implies that you and your colleagues are willing or likely even to take practical action to deal with a problem or situation. And a great example of that is Val and her team at Granite Falls identified challenges they were facing in terms of staffing and organizational structure. Rather than making decisions blindly, and as I mentioned, they had their hunches, they had their feelings of what needed to be done, but rather than make those decisions blindly, her team relied on data to become action-oriented and make decisions in an intelligent manner. And the really key piece is because they relied on data to drive that decision-making, it led to greater buy-in from staff members, which is extremely important. So while Granite Falls' journey is not complete, the team there is already seeing benefits, and more importantly, seeing future benefits of this new approach around data. A quote from them: "Our organization intends to fully utilize BI and believe by doing so, we can validate our decision-making process. This creates an environment of transparency and open communication." And the transparency and open communication is huge, because when staff members, regardless of the level they're at, when they understand why decisions are being made, they're much more likely to hop on board and buy in to those decisions, whatever they may be. Principle 4, lean on data to drive effective and intelligent communication. So ask yourself this question: how much time do we waste in ineffective communication? So ineffective communication might include discussions that don't address your ultimate goals. They might include time spent generating and transforming Excel spreadsheets that leaders need but don't get in a timely manner. And they might include conversations and thoughts that occur with no data or substance to back them up. And there's a quote I'll introduce later on that really touches on the importance of data when bringing a conversation up, or a conversation or feeling up to someone. And it's really how important data is in backing those thoughts up. For your hospital to not merely remain relevant, because nobody wants to only be relevant. Everybody wants to thrive. Everybody wants to provide the best care for patients, the best working environment for staff, and be a significant bright spot in everybody's community. For a hospital not only remain relevant but thrive, you need to start treating data as a strategic asset, with processes and systems that allow the right data to inform decision making and drive results. Really similar to what Granite Falls is doing. They're in the process of doing that. It's not over, but they're in the process of moving there. And I really believe it's more important than ever before, as more constraints are being put on your organizations, as expectations for there to be more done with less resources. That really is just an expectation now. Leaning on data to drive decisions and become as efficient as possible is really important in today's day and age. So another a takeaway that Val had that she shared with me is this. Since this project began months ago, we have come to realize how important this data is to both the leadership team and frontline staff. And that, I'm going to stop there. That's really important. Leadership team and frontline staff. This is not a tool or a solution that only leadership uses, that only executives use. This is a tool that everybody in the organization can benefit from. She goes on to say, they now say they better understand the rationale behind decision making. And that's a really important message. Getting buy-in, I'll repeat it again, getting buy-in from all members of the organization is oftentimes really difficult to do, but when it's accomplished, it allows for pretty powerful transformation and movement within an organization. All right, keyword number 3, yellow. Take a moment to make note of that. And the last, principle number 5, think like a scientist and be skeptical. Always validate your data. And ultimately what this means is don't become complacent. Don't be satisfied with the status quo or, this is how we've always done things. This is always where staffing levels, for instance, this is always where staffing levels have been. It's comfortable. It's what people are used to. As you start utilizing data more, if you see that costs, for instance, were slightly higher in one month, or perhaps departments were overstaffed when volume was low, make sure to stop and ask yourself why. And after you've pondered that, take it to department managers and have that conversation with them. And when you bring data to the table, it'll allow for a pleasant conversation rather than it coming off as a scolding or kind of punitive. It'll allow for just collaborative conversation. Leveraging BI equips you with the data and the tools you need to ask the questions and get to the root of whatever the problem may be. So this is what I had mentioned earlier about the importance of data. And it's without data, you're just another person with an opinion. And that's true for, I'm sure, all of you. It's true for myself here when I work with my colleagues. Really, whatever you bring to the table and have to say, without sufficient evidence or sufficient data, ultimately it's just another opinion. So I'm sure many of you can relate to that. And kind of where I'd go from there is everyone has someone that they answer to, whether that's your manager, whether that's the CFO, the CEO, maybe it's the board of directors. Everyone has to answer to somebody ultimately. And sometimes that can be intimidating. If things are going super well and super smoothly, yeah, those conversations are going to be very pleasant. If things aren't going as well, or if numbers aren't where they need to be, sometimes those conversations can be intimidating. But once you're equipped with reliable, strong data to support decisions you're making or to support why things are how they are, there's a really great confidence that comes with that. and it makes those conversations with whoever you're reporting to much easier and much less stressful, and it just allows for more to get done and less kind of beating around the bush, I'll say. All right, so we've introduced data, we've introduced how organizations can leverage it. I've introduced business intelligence. Now I'm going to get into really what business intelligence is. I'm sure you've heard the term. You've heard BI, whether that's at conferences, whether that's in web conferences like this. So Gartner, they define BI as an umbrella term that includes the applications, infrastructure, and tools and best practices that enable access to and analysis of information to improve and optimize decisions and performance. So kind of a mouthful, but when you break it down into kind of the various words I highlighted, applications, infrastructure, and tools. So that's some of what I've presented here. Tools and solutions that your organization can incorporate into your daily life and your daily workflow. It enables access to and analysis of information. So it brings that data to the forefront. It brings the data to your table and allows you to utilize that in decision making. And really what the important takeaway here is, it allows the user to ask meaningful questions and uncover information in real time or close to it, which leads to improved decision making and improved fiscal sustainability. So discover the data, leverage the data, improve your decision making, and ultimately improve business operations. So next, you're probably asking, okay, I have a somewhat of an understanding, at least, of BI. Who do we equip with BI? Who within my organization do I provide this to? I provide this resource to? The short answer to that question would be everyone, in my opinion. Everyone from CEOs to CFOs to department managers, all the way down to frontline staff, I truly believe will benefit from BI and from increased visibility into operations. Really, it allows people at all levels to perform better. And one thing we often get from leaders is, well, I don't want frontline staff to be able to see everything, whether that's financial data or more sensitive operational data. And that's very fair and a reasonable thing to bring up. But there's plenty of ways to set who views what in the solution. So at the end of the day, there is data that everybody in your organization can benefit from. When you think about it, everyone in an organization has a different question they need to ask of themselves. And this is really important. This is something I think you can take back and implement right away. So these three levels of people, I'll say, and this might not be completely representative of your organization, but I think it comes close to hitting the mark. So we start off with directors. Directors need to be asking themselves, are we going in the right direction? They're less concerned with the day-to-day operations and more concerned with the overall trend of the business. So are we going in the right direction? Department managers, they need to be asking themselves, what do we need to fix? Whether it's staffing, costs, patient satisfaction, what needs to be addressed, and are we doing so in a timely manner? So they're more in tune with day-to-day operations, and they need to be able to identify quickly something that is out of whack or something that needs addressing, and they need to address it immediately. The next level would be frontline staff. They need to ask themselves, how do I fix it? So once it's been established by department managers that, for example, patient satisfaction needs to be addressed, what is being done to fix that? Is there more communication that can happen between staff and patients? If it's staffing, are people aware that when volume's low, or are people aware that when volume is anticipated to be low, that staffing needs to be adjusted accordingly? So those three different levels of people within the organization, they all need to answer a different question, but business intelligence and a greater use of data allows each one of those levels, from directors to managers to frontline staff, to answer the question that they're responsible for effectively and probably most importantly in a timely manner. Everyone in the organization, everyone in your organizations have a role in the performance of the business. Equipping the organization, and again, that's all levels, equipping the organization with the right tools is crucial. And something that we oftentimes find with organizations is they say, okay, we'll start with this, we'll start with business intelligence, but we're only going to give it to our directors. Which sometimes that's fine. That's fine to start there, but what they quickly realize is that, okay, now everybody needs this, because frontline staff are seeing directors use this data, and they're saying, well, what about me? If you expect me to hit these numbers and deliver on these targets, well, I want to be equipped with the tools and resources that best set me up for that success. So oftentimes those organizations who start with maybe just the top level, they end up understanding and realizing the importance of equipping everybody in the organization with the data. So this graphic, transitioning from data to insight to action. So ask yourself if you've ever been in a situation where you're making decisions blindly. This ties back to data literacy when I brought that up. If the data in your organization, or the data your organization is now capturing, if it's not understood properly, and if it's not tied directly back to your strategy, it can actually have a negative impact on your organization. It can lead to what a lot of people are familiar with, the term analysis paralysis. And that's really an urge to keep collecting data, just collecting, to ensure that all risks are covered. But it's actually preventing you from moving forward. It's preventing you from making decisions that set the organization up for success and move forward. The need to align the data and your understanding of the data to your strategy and the decisions you make is paramount. And that's one really key takeaway that I hope you have from this presentation is having a sort of a data model or a well thought out plan around data is very important, but the need for that plan to be aligned with your strategy is of utmost importance. Because if that's not the case, it causes confusion among staff. Staff become unsure of what really is the ultimate goal of the organization. So really, the need to align your data strategy with your overall organizational strategy is huge. So there may be a few of you out there, but I'd imagine there's not many people out there who enjoy sifting through pages and pages of Excel reports, that have thousands of lines, and you're trying to arrive at the single piece of information you need to confirm what you're thinking about, whether you need to hire one more nurse. I'm sure that's a conversation and something that's been brought up in your organization many times. So this first visual I bring up, this is what a lot of people are used to seeing. It's your typical Excel spreadsheet that someone in your organization presents to you, and again, you have to sift through the spreadsheet to arrive at really any meaningful data and takeaways. With BI, organizations are moving away from the manual process of requesting Excel reports, then waiting on those reports to be created, and then spending far too long analyzing those reports. BI gives you the insights you need in a clear, concise, and well-designed manner, which allows for quick decisions to be made and allows you to spend more time on the things that matter. Really, if you're a leader of an organization or you're a department manager, you shouldn't be spending hours and hours and hours every week, sometimes every day, analyzing Excel spreadsheets when you're trying to maybe determine something with the budget process, or you're trying to justify a decision when it comes to staffing levels. That's not the best use of your time or truly anybody's time. So we're working with organizations to move away from that process of manual reporting, delayed decision making, into this model now, where the data and the reports are just constantly at your fingertips. So whether it's something with operations that you need to access, or whether it's something with financials that you need to look at, this allows for you to pull that up now, and it allows for that conversation that needs to happen to occur right after the fact, rather than a week after it should have, or a month after it should have. There's way too many decisions that are being made in organizations, conversations that are being had that occur weeks and months and quarters after they should have. So with a BI strategy, with a BI solution, it eliminates that, and it allows for proactive decision making. So this is kind of a fun visual, a fun graphic. If you recall, I said earlier that organizations need to start treating data as a strategic asset. So this is what this visual really conveys. It's saying data is the new oil. And there's all sorts of kind of interesting statistics that are included here, but are small, so I'll gloss over. But there is a quote from this study that this visual is from, that says data should be considered an economic asset, similar to oil. So that's a pretty powerful statistic, especially for people in my area in the Midwest, who are very familiar with oil and the boom that we've seen there over the last number of years. Because of the increased EHR adoption rate and the move towards more advanced technological systems in healthcare, there is so much data that's available to all of you now, and really the ability to access that data is becoming much simpler, and that's really the ultimate purpose of business intelligence. It allows for access of that data regardless of the system it's in. So if it's point-click care, or it's Healthland, or it's Great Plains, if it's your EHR or your financial reporting or payroll, whatever the system is, BI can tap into those disparate systems, so those systems that otherwise are not connected. So that's why I call them disparate systems. BI can tap into those systems and create the correlation more or less automatically. So rather than having to pull out information from your financial reporting, and then pull out information from your EHR in regards to operational data, and then the user is tasked with creating some sort of correlation manually, which can oftentimes be really difficult and sometimes not accurate. Business intelligence allows for that process to be done really seamlessly, and then you as the leader, you as the decision maker, you're equipped with that data, really in the snap of a finger, and it's accurate, it's timely, and it's data that really sets you up for great success. So these are just a few more sort of fun statistics, fun thoughts to think about. So the first one, 247 billion emails are sent every day, and many of you probably feel like you may account for half of those. Next one, from the beginning of time until 2003, we created 5 exabytes of data. And don't ask me what an exabyte is. I know it's a lot, but what that actually means, I'm not sure. In 2013, the same was created every 10 minutes. So, while those are fun to think about, what this really tells you is that the influx of data and its importance is not diminishing anytime soon. The data is there. The data is not slowing down. The data will become more complex and ultimately more useful for your organization. So there's really no better time than now to kind of get your hands around it and begin understanding what it can do for your organization. So I'm going to walk through a few examples here in these next few slides and these are just screenshots of different reports and different models we've created and can create for organizations to understand their data better. So the first visual is from work we're doing with the Michigan Center for Rural Health. Most of the hospitals in that group have joined sort of the state benchmarking group, which provides them operational, cost, and financial data for all of the participating hospitals, and it allows leaders to leverage that data and then measure their own performance against their peers. And it's so cool what they're doing in Michigan because they've agreed upon transparency. So in this tool, they can see the names of other hospitals. They can see which hospitals are performing optimally, which hospitals maybe have work to do in certain departments, and then that allows for them to maybe reach out to the CEO or CFO of that hospital and say, I noticed you were able to hit this benchmark. I'm a ways off from that. How do you do that? And it begins this conversation and this collaboration amongst facilities that I think is really, really cool. So the second visual demonstrates work we're doing with the health system that right now is utilizing BI as well as RTLS, real-time location services. So this organization is leveraging this data to understand patient volume, flow through the organization, and utilization of providers. So you see 5 sort of key metrics that this organization has decided is important to them, and sort of how they're utilizing those and goals that they've built in to a few of those metrics to show staff that if it's green, we're hitting it, we're reaching our goal. Good job. If it's red, we're slightly off. What needs to be done? What can we change in our process to make sure that we hit that goal next week or next quarter? The third visual demonstrates the ability of an organization to understand trends when leveraging BI. And a snapshot like this allows for leaders to hone in on problem areas and address issues sooner rather than later. So if you see a number, if you see a trend that's heading down, or maybe it's a number that shouldn't be where it is, month to date based on previous figures. It allows you as a leader to catch that and have that conversation with whoever it needs to be had with about what can we change right now to make sure that we move that figure and it trends up rather than the current trend down. The fourth visual here is from a model similar to what Granite Falls is utilizing. And this demonstrates the ability to understand productivity amongst departments. So you can toggle back and forth between from department to department, med-surg, ER, laboratory, and understand productivity amongst those on a daily basis. And when it comes to staffing, respond accordingly when volumes are low. So it's showing you worked hours, it's showing you statistical volume for whatever department you've selected, and then that department productivity with, of course, the benchmarks that we would say this is where a top performing hospital should be at. So this is data that oftentimes, even if you had access to it, you might be reviewing it on a quarterly or even a lot of times yearly basis, which to a certain point is good because it allows conversations to be had in determining, okay, these departments need to be worked on. So those conversations can still be had, but when the data is fed to you daily, close to real time, it just allows for much more proactive decision making. It allows for corrective action to be made, and so if something is trending in the wrong direction, it allows for correction to be made and cut that off soon, so that it doesn't persist and doesn't continue to negatively impact the organization. So there are significant efficiencies and advantages to be gained by having a well-structured data strategy. I hope by now, as we've gone through sort of maybe the evolution of data and business intelligence within organizations, I hope you're starting to kind of put the puzzle together and understand some of these advantages and efficiencies. You've heard how Granite Falls is currently in the process of realizing some of these benefits. As I said earlier, they're not complete. They're not at the end. But really, if you're utilizing business intelligence effectively, you never reach an end point. It should be sort of this living, breathing tool that sort of just kind of sits in the background of your organization, and allows leaders and allows staff members to make decisions better and more timely. So Granite Falls, again, they've more appropriately structured their organization as a result of this. Their staffing levels are more aligned with benchmarks, and their communication has really improved. And that's something that shouldn't be taken lightly, is how significant effective communication can be in an organization. When everybody's aligned, when everybody understands what the goal is, when everybody understands what's expected of them to get and reach that goal, the chance of that happening is much more likely. And I'll say that organizations that have invested into these efforts and they're gathering new operational data that really previously hasn't been available to them, and that's leading to care improvements, financial improvements, staff satisfaction improvements. I think sometimes staff can be frustrated when there's these great expectations on them, but they maybe feel they're not equipped with the right resources to reach those expectations. Once staff have has these tools in their hands, their satisfaction increases because they now feel like they're being supported by the organization. And one thing that myself and others here at Bailey, I always try to communicate to organizations is this: the organization or the individuals you have employed, they're smart individuals. They want to do the right thing for your organization. So investing in tools like business intelligence, it'll equip them to perform to the best of their abilities and make decisions that lead to better outcomes for the hospital. And lastly, I'll repeat it one more time. You need to make sure to align your objectives and your goals with your strategy. Don't have those be two separate, distinct things. When pursuing a better use of data or a business intelligence solution, make sure to align that to your strategy. And if you're a leader of an organization, communicate that to managers, communicate that to your frontline staff. The three sort of pillars that you see at the bottom of the screen there, people, process, technology. All three are very, very important. But if you take one of those away, whichever of the three is removed, the picture and the complete strategy there, it's kind of like a dent in the armor. You need people, you need processes, effective processes, and you need good technology. All right, and keyword number 4 is CAH, so C-A-H. Take a moment to make note of keyword number 4. Well, thank you to everybody who's joined us today. I hope you found the presentation insightful and encouraging. I know as I visit with hospitals, many have expressed interest in pursuing something like this, but they don't really know where to start. So, how does I hope this provides some encouragement to organizations who are maybe looking at pursuing something like this. BI is no longer only for the large hospitals and health systems. Critical access hospitals are starting to see the benefits of it, as we speak. And like I said, it's a journey. It's not something that's accomplished overnight. But those benefits are starting to be realized by critical access hospitals like yourself right now. So I'd encourage you to continue to think about that and how that might impact your organization. And we have time for questions, and I'm sure we can have those issued through the chat box, if that's correct, Allie.
Yes, that is correct, and it appears you do have a couple of questions in here.
All right, I saw a few come in here. So one question I'm seeing here: how does a small, under-resourced CAH get this done well enough to be usable? Very valid question. So, that's one thing that many organizations express right away is that, without really understanding what the cost may be, they say, we likely don't have the resources to do it. And again, I'll say that the cost barrier to something like this has been reduced dramatically. So it's much less of a impediment for smaller organizations. There are pretty well built solutions that we can deliver that don't require financially very significant resources, and when it comes to maybe personnel, when in regards to resources, the beauty of this is beyond sort of the initial couple of steps in setting things up, in validating information to ensure everything is accurate. It's largely developed and then runs in the background of your organization. So for organizations who maybe don't have a really strong IT department or an analyst on staff, you really don't need that personnel to have a solution like this be successful and really usable in your organization. Another question is, so it says you mentioned Microsoft BI. Is that primarily what iDaily uses, or do they use multiple different softwares to implement BI? So what we always say is we're software agnostic. We don't limit ourselves or limit the client to a specific solution. We've worked with multiple solutions. The primary reason for maybe our heavy use of Microsoft Power BI is that the cost of it for the client is just much lower. It's a if you look at, there's different studies out there on the kind of the effectiveness of Power BI versus other solutions like Tableau or Burst or and Power BI always ranks right at the very top. So it's both a solution that's really powerful and really proven, but it's also a solution that's really it's reasonable for smaller organizations. So that's really what it comes down to is it provides the least resistance for the client, and it's also a really proven tool. Any other questions? Feel free to jot those down in the chat box. Well, if there are no other questions, we can continue on in closing. What I will say is if you do have a question that comes to you maybe after the presentation or something that comes up after you visited with colleagues, please feel free to reach out to me. My email is included in the last slide here, and we can continue the conversation and I can help answer any questions you may have on this topic. So thank you again. Thank you for joining us. Lastly, I want to make sure to invite you to our iDaily's 2019 Critical Access Hospital Conference, which will be held in San Antonio, Texas, next year on April 4th and 5th. Watch for more details coming soon. This is always a great event, great collaboration amongst attendees and presentations and sessions that iDaily has arranged. So make sure to make note of that on your calendars and watch for more details coming soon.
And Sam, in case you did not notice, you have one more question in the chat box.
Oh, I see that now. So the question is, for those of you on, when pulling together multiple systems like EHRs, payroll software, is this something that iDaily sets up as part of their services or something the local site would need to figure out how to implement? Terrific question. And the answer to that is iDaily takes care of that. So that gets back to not putting a strain on your personnel within your organization. It does require some back and forth with maybe your IT director, but but Eid Bailey, we make those connections to your EHR, to payroll, and do kind of what is the data mapping, and figuring out how those systems need to speak to each other. So we take care of all of that as part of sort of the deliverable, and that allows for you and your staff to continue with your day-to-day responsibilities and operations. Any other last questions before we wrap up? Feel free to include that in the chat box. All right. Well, like I said before, feel free to reach out to me. My emails and phone numbers included in the slides, and we can continue having this conversation if there's anything you'd like to visit about further. And again, make note of the Eid Bailey CA conference happening next year. Thank you all for those of you who joined, and I hope you enjoyed it and have some useful things to take away and start conversing about with your staff.